this summit is quite literally a call to action bringing people, place and system together to look at how we can advance health equity for the Bangladeshi population in London.
It is really fantastic day with the collaboration with the Bengali community. Such a kind of program normally is not taking place here. So I'm really happy to be part of that.
We have invited leaders from NHS England, NHS London, Greater London Authority, local councils, local NHS, all coming together to action on the health inequalities Bangladeshi community is facing.
We discussed about access to health services and what are the structural barriers to access health services for the Bangladeshi community and how we can address it. By addressing racism, we are going to address health inequalities because the structural barriers leads to health inequalities.
We knew there was institutional and structured racism within our health services, and that dampened the health impact on our communities. I hope after this conference we're able to do something tangible.
As Director of Public Health, I know that the Bangladeshi community have really significant inequalities in health, particularly around diabetes, heart disease, but also in relation to lower uptake of immunisation and cancer screening.
The health of the Bangladeshi population is of immense interest to us in Tower Hamlets because they constitute a large part of the local population. Their disease profile is got slightly different than the indigenous population. They suffer from a high incidence of diabetes, cardiovascular diseases, cancer, and other sort of chronic diseases, including asthma and COPD.
And we're hoping really to have a clear and careful discussion about this diabetic emergency in the local area, which is type 2 diabetes in people under the age of 40. And we're really concerned about it. We really want some important ideas and plans to try and address this huge issue in the future.
What we need to do is raise awareness and take prevention measures, and if somebody is suffering from diabetes, how do they manage diabetes? The very first thing to do is make the community aware of what are the issues.
We need to make sure we're having really positive conversations about how we move forward. So a call to action for all to work together to realise improvements and really engage with our Bangladeshi community on what's going to make a difference to them to enable them to have better health and feel that their health needs are taken into consideration.
It's good to come back together. It's been a while since we had the opportunity to really learn from each other about what's worked in the past around supporting the Bangladeshi community. And it feels like the London Bangladeshi Health Organisation partnership has been able to pull together all the learning that we've built up over like 10 or 15 years. And this is a chance to build from what we already know rather than starting all over again.
I just wanted to emphasize our support as an organization for all of the local work, our commitment to inclusion for the local population, and our recognition of the deep connection between inclusion and the need to meet the equity needs of our local population, particularly the Bangladeshi community in Tower Hamlets.
Today I'm excited to hear about the fantastic work being done in East London, whether on tackling chronic diseases, on dealing with infectious diseases, on building community resilience, and ensuring that we're thinking about current and future generations as we build health and wealth in this part of the city.